Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Musick, Clinical Specialist of Infectious Diseases at Houston Methodist, and we're going to talk about how his team is using real-time data, rapid diagnostics, and enterprise-wide collaboration to transform antimicrobial stewardship and patient safety across their system. Great having you here today, Will.
Thanks for the opportunity. Happy to be here.
Of course. Let's get started today with just a little bit about your background in pharmacy and infectious diseases and your role at Houston Methodist.
So I've been a pharmacist practicing in infectious diseases at Houston Methodist Hospital for the last 20 years. I grew up in Virginia and spent most of my life prior to Texas 20 years ago in the southeast U.S.
Houston Methodist has an incredibly advanced antimicrobial stewardship program. What first motivated you and your team to take this data-driven approach to infection management?
The clinical pharmacy group at Houston Methodist had been involved in partnerships with our infectious diseases providers, supporting them in their day-to-day activities for a long time, even prior to my becoming part of the team at Houston Methodist. Once we decided to up the ante on our infectious diseases pharmacy program by starting a training program in infectious diseases pharmacy, a number of opportunities showed up, and one of them was a pilot program that ultimately became our infectious diseases stewardship program. Through the development of our postdoctorate residency training program in infectious diseases pharmacy, the opportunity to collaborate with our microbiology lab as well as our infectious diseases providers presented itself to attempt to translate very interesting technological advances in rapid molecular diagnostics in the laboratory setting into similarly rapid interventions in actual patients. And it was an opportunity that we could not walk away from. And so that was really the genesis of tying infectious diseases, pharmacy, antimicrobial stewardship, and actual data together.
And your blood culture surveillance program began more than a decade ago, long before real-time analytics really became common in healthcare. Tell me what problem you were trying to solve when you launched this initiative.
The problem we were trying to solve was a problem of getting information to the person that needed it as soon as possible to make the most appropriate decision for an individual patient. The old adage is that if a tree falls in the woods and nobody's there to hear it, does it make a noise? Well, we have no idea. But if a point of data is entered into the electronic medical record and nobody ever sees it, is it really there? So information, as critical as positive blood cultures, must be taken to someone who can affect change as quickly as possible. And that's the critical step that we were trying to address with our blood culture surveillance program.
And a program of this scale requires deep cross-departmental collaboration. How do you bring together microbiology, pharmacy, IT, and clinical teams to create a unified system that works across 7 hospitals?
So it's never without its challenges. We developed the program at our flagship 1,000-bed referral teaching hospital. It's a very different place than a 450-bed community hospital, predominantly in terms of resources available. And so we are lucky in that we were able to utilize the economies of scale that existed within our own system. For example, our micro lab does the microbiology for the entire system at our central campus. And so we already had the wet information, so to speak. And then all of the dry lab information all came from the same place. It was only the end user experience eccentricities that we had to iron out over time. So while there definitely were differences from site to site, process variables that needed to be ironed out, honestly, just because of the magnitude of the information and everybody involved in the decision-making process understood how important the information was, it was doable. And everybody chose to adapt where adaptation needed, as well as innovate where processes didn't exist before.
And the backbone of this program is really real-time analytics. How do you turn that constant flow of data into meaningful action for clinicians and pharmacists across the enterprise?
It is difficult. There's a lot of information that gets dumped into a electronic health record daily, even hourly. And the ability to make specific information bubble to the top, information that we know must be acted upon in a timely fashion. And so that's where we turn to technology. Even prior to the development of our stewardship program, prior to the development of turning these microbiology lab data points into decision points, we already were collaborating with Vigilance at the time, which is now part of Inovalon, for other things that we needed to be acted upon very quickly. And so it was a natural progression to see if we could collaborate through that platform and solve the problem of not relying on a necessary kind of feed forward process where Micro knew there was data, and so they had to call us. We know there was data, and so we had to call someone else. We could just make it happen. We could automate the process.
So let's talk about the results. What results have you seen since implementing this data-driven surveillance model, and how have you kept it sustainable and relevant as technology and clinical practices have certainly evolved?
You can, hit us up on the internet. There's a handful of listings in PubMed and a number of publications that we've been able to get out to highlight the success that we've seen. And we love to do those things, but at the end of the day, we do it because there's a patient at the end of it. We have been able to show in those publications that we decreased the cost of an individual's health care with various types of infections. We have demonstrated that we have decreased similar individuals' length of stay in the hospital. We have demonstrated that we have impacted the actual mortality, the live or die of getting the right information to the right people at the right time to make the right decision. And so we're very happy with the proof that we've been able to put into the literature and around our healthcare system, both at a system level as well as an individual hospital. And we've been able to sustain those things because our organization values what we bring to the table. They continue to support us. The individual hospital members of the system value this program, and we think we're doing the right thing at the end of the day for the patient.
And I'm really glad that you brought it back to the patient, because it certainly is easy to lose sight of why we're all here doing what we do in healthcare, and that is because of the patient outcomes at the end of it. So as we wrap up today, is there any advice that you would share with other healthcare leaders who are looking to build or scale a sustainable, data-driven stewardship program of their own?
Find a spot where you believe you can make a difference. It doesn't have to be huge. At its most essential, we started a partnership program with our microbiology lab and infectious diseases providers to get culture results to them in a personalized fashion. Along with it, bringing any assistance that we as ID-trained pharmacists can provide. That's pretty much just the gist of what we do. But we took that and rolled it out hospital-wide. We structured it, and we made a process that was historically haphazard to something that was purposeful and a well-oiled machine.
Well, you guys certainly have done some incredible things, and I really appreciate you sitting down and sharing that with me today and our audience. Thank you so much for being here and for the great conversation.
The pleasure was mine. Thank you very much.
And to our audience, thank you for watching, and be sure to keep an eye out for our next episode of INOvators.